Hey everybody, it's Jim Prevost back with Embrace the Shake. I know that we've been away for quite a while, but had to take a break to get some medical diagnostics done, and um, now that everything's all good to go, and we know what we're dealing with on the movement disorder spectrum, I thought it'd be a great time to get back to work with the Embrace the Shake live cast. Um, First of all, I want to say thank you to everybody that was kind and sending their well wishes while we took the break from Embrace the Shake. We did work on some projects while um, we were taking our off air time, and as I said, had some diagnostics done, and we are all ready to wage the new fight against a different type of movement disorder um, versus the Parkinson's. Uh, First of all, I did have the brain scan, the DAT scan, and it confirmed that I did not have Parkinson's, but it did confirm that I have a mixed movement disorder that involves myoclonus dystonia and chorea and tremors. And this is a movement disorder that is manageable. It does progress, but not in the same manner as Parkinson's does. In addition to that, the medication has been validated that they gave me in March, and it is doing a good job. Um, I think the biggest thing is that I'm finally starting to feel human again, and I am much improved. My cognition is much better. My executive skills, sequential thinking is much better. And a lot of that was caused by the medication that I was taking for Parkinson's, that I was becoming so infiltrated with dopamine and a few other drugs that it was actually causing a problem. It's very good to see Shelley Prevost tonight from Tennessee. Cousin Shelley, it's good to see you and Big Pre. Kelsey Tilley, an athletic trainer, friend of mine and former student. David Miller, former wrestler. Vicki Murray from Shelby High School, an icon there. It's good to see you as well. We have some rather amazing news tonight on Embrace the Shake about a project that we're doing for an Army buddy of mine, combat veteran, wounded combat veteran. And I just think the world of this fellow. We were linked up by Angela Connor from Rescue 22, who sponsored and trained my service dog. And I met Craig through her. Craig Kohlberg is his name. He lives in McAllen, Texas, and we'll be talking about Craig a little bit later tonight. Craig is really a top-notch guy, and I'll tell you a little bit about his story. And I will tell you about the many folks that support our Embrace the Shake live cast. Not only do they do work for us for, would you say, pro bono, but at the same time, most of the businesses that I'll talk about have direct reference to the veterans community. They train service dogs. There's a couple businesses that are veteran owned and veteran operated, and I'll bring those about a little bit here in a few minutes. So let me go ahead and get started. Tonight I'm going to be talking about two subjects. Sergeant Kelly, good to see you. I support the blue, and I appreciate your daily heroism, putting that battle rattle on every day and protecting the citizenry of Cherokee County and South Carolina. And I appreciate the relationship we had when you were a recruiter in Shelby. You do a great job. Good to see you, Brian Jackson, former football player of mine, great young man from Gaffney. First of all, I'd like to say thank you to Rescue 22, as I always do. I always start live casts with thanking Angela Connor, Eric Ennis, and John Devine for what they did to bring Moose into my life. Moose is actually taking a nap. He had a long day today. We did a lot of things and some training, and just he just had a day and he had to take a break. So Moose sends his regards. Magic City Canine and Applause Your Paws with Dee. Dee Howe, she is very instrumental in training service dogs. She has a wonderful program at the correctional facility near where she lives in Miami, Florida. Inmates learn the wonderful skills of dog training. That way they have an applicable profession when they come out from serving their time in the correctional facility. Whitebeard Canine, Howard and Lisa Young, again, amount of training for Moose during this formative time. Howard is a nationally recognized, nationally renowned canine trainer for law enforcement. He also does some protection training as well. And Howard is just a really good friend of mine, and Lisa love him to death, and we consider him to be part of the Prevost family. Paul Fleming, my fraternity brother, is on tonight. Paul and I have known each other for over 40 years, and we do a lot of things together. Rhonda Lale, she takes care of me. She's one of my nurses at my neurologist's office. Thanks for being on. Broad River Hemp, they are located on Lafayette Street in Shelby, North Carolina. Veterans discount, 20%. Veteran owned, 100% disabled. Runs that along with his lovely wife. By the way, they're expecting. And for those who require hemp needs, CBD, flour, oils, they don't have the patches or the gummies yet, but incredible folks, very knowledgeable about CBD, the different purity levels, and how that works with different disorders. Lawn and Order is a landscaping company that is run by law enforcement officer, a state level law enforcement officer, and Lawn and Order. They can be located in Shelby, North Carolina. Just look on Facebook, you'll find them, and give you a great price. Gives veterans, law enforcement, EMS, and fire 10% discount. And then 5x5 Brewery, and this is in Mission, Texas. 5x5 is owned and operated by veterans, and George Rice is the owner. He served with Craig at the 10th Mountain. He also did some time at Fort Bragg, as well with the AWG. And he's just an incredible guy. We did a Zoom today, and has been involved in many veterans activities in the community. And with the coronavirus, they have been significantly shut down as far as being able to provide restaurant and brewery services to their normal patrons. So if you're from Texas, drive to Mission, Texas, visit with 5x5 Brewery, and give them a holler, a visit, buy some of their Merc, and enjoy a beer while you're there and some of their food. And part of their profits go to veterans activities and veterans support. And so the first part of my topics tonight, I want to talk about Parkinson's related pain. And the sad thing about Parkinson's related pain is that it is a part of the misdiagnosis process. Often the Parkinson's related pain is passed off as orthopedic pain, age-related pain, incident-related pain, when really what it is pain that is generated from the basal ganglia in the head, generated from the gut, and becomes more systemic in the nature that it spreads throughout the body. So I want to talk a little bit about that in ways of managing it. So I'm going to refer a lot to my notes because I want to make sure that I provide you with the correct materials, the correct information. And as always, I look for multidisciplinary studies that are studies done by a group of individuals that have different medical backgrounds, and all of my articles are peer reviewed. At the same time, there are disclosures on the interest in the study. Therefore, there are no conflicts, meaning that this was not sponsored by a certain product, a specific hospital, a specific research center where somebody is employed to produce this type of research that favors the findings of their facility. This is from the Journal of Multidisciplinary Healthcare. It was written in 2018. Of the 20 articles that I scanned, this really seems to be the best article to help understand Parkinson's-related pain. But first of all, I want to talk about the brain itself and the basal ganglia and dopamine, okay? And basal ganglia is primarily a motor control area of the brain that also helps with motor learning. Hey Rex, good to see you. Al Clary, Vietnam vet and college friend. It also helps with the formulation of executive functions, having the ability to keep things in sequence. It helps us with our emotional behaviors positively, and at the same time, it can have a negative effect and cause addictive type behaviors. And that can be medication related or a disease related process. And as always, I'm going to yawn, so please excuse me. And in addition to that, it helps us with our habit formation. And not only is that motor habit, meaning muscle movement, but that is behavioral habit as well. Okay, so that covers the basal ganglia. I want you to keep that in your mind. Another thing is you'll hear me use words like dopaminergic. I'm just going to get off that technical term and just say dopamine drug. Okay, so another thing is with Parkinson's that dopamine does help an individual deal with pain. It gives it a positive effect. It helps us to control the level of pain at which we are able to endure. It can help with the gate theory where pain is allowed in or pain is not allowed in for us to receive and recept through our somatoreceptors. And now I'm getting technical again. But the key points are that when Parkinson's folks or people with movement disorders that have a dopamine malfunction, then what happens is that lessens the ability of the body to handle pain, and at the same time is a significant contributor to the neuro and biochemistry that causes us to deal with pain and at the same time indicate pain, okay? So in a nutshell, when your dopamine is good to go, you can deal with more pain. It helps block pain, and it provides the appropriate motor responses, nerve responses to adapt to the pain through motion activity, rest, epinephrine, and norepinephrine production that is our body's natural morphine. When dopamine is in delay or when dopamine is diminished, it doesn't allow that function. Okay, so the research that I talk about, the wide-based study here showed that between 40 and 90% of folks with diagnosed and confirmed Parkinson's disease or a Parkinsonian-like disease experienced pain throughout the course of the day. It is an ongoing pain. It's from the time they wake up until the time they go to bed, and then sometimes they have pain at night, and that's called dystonic pain. And dystonic pain is pain that from a dysfunctional muscle tone, cramping. Okay? So that's dystonic pain. Dysfunctional, D-Y-S, dys, and then tonic means tone. Dysfunctional tone. A cramp is a dysfunctional tone. Muscle tissue that is too tight is dysfunctional tone. Muscle tissue that is too flaccid is dysfunctional tone. So dystonia has a couple different meanings. Okie dokie. So, in dealing with Parkinson's pain, it is the key responsibility of two people. The first person is the person that's experiencing the pain, to be really in tune with their body and be able to pinpoint and identify where the pain is, what times of the day the pain is worse, what movements may cause the pain, or what lack of movements may cause the pain. And also associating when their medication on and off times are. If the pain gets worse when the medication, is in its off time, or is the medication at worse when the medicine's initially introduced in the body? Because there is pharmacological associated pain. And what that is medications that you take for one purpose have a side effect of increasing an issue in another side of your illness. I'll provide the example. When I was taking Rytari for Parkinson's disease, for dopamine, it was really helping me with my range of motion. It was really helping me with swelling. It was really helping me with pain that I have in my shoulders, my neck, my back, and my hips. But what it was doing was causing all kinds of gastrointestinal issues. And guess what? That's where Parkinson's manifests, in the gut, okay? In the gut. So the doctor would use a multimodal type approach, meaning modes of treatment, multi meaning many, multimodal type. And when fighting the nausea with Zofran, it would lessen the ability of the Rytari, so they would kind of like sneak in and give you another drug to do the same thing what the Rytari was losing. So the dopamine effect from Rytari that was supposed to be positive was being minimized by the Zofran to fight the nausea, and then the carbidopa levodopa that they gave me would pick up the slack of the Rytari. Well, that worked really well for a while, and then those two combined with each other and completely overloaded the Zofran. And I just got very dopamine toxic. And it was disguised by the multimodal approach. That was the pharmaceutical overload of dopamine, because the pain level was getting worse and worse and worse. The range of motion in my upper extremities was getting worse. Coach Lamb was on tonight, and he can validate that my gait changed, my posture changed. And what was happening is I was becoming toxic or tardive from the dopamine, when in fact I didn't have Parkinson's as initially diagnosed over a period of 3 years by 5 different doctors. I had to go to Duke to find out that I had a different movement disorder that can be controlled by a different single medication. Single. So that's pharmacologically induced pain. A lot of times, folks that have Parkinson's pain, hey, how you doing, Molly? Good to see you. Doc Thompson, good to see you as well. Thanks for coming on tonight. Parkinson's patients that have joint pain throughout their body, inclusive of their neck, a lot of times that's blown off as orthopedic pain from previous history of injury, or positional orthopedic pain like stiff neck, torticollis from sleeping, in an odd posture, or muscle tension related orthopedic pain where we get stiffer with Parkinson's. Therefore, what happens is that it causes the joints to become somewhat adherent, not like frozen shoulder, which Parkinson's patients have a problem with that, but they become more adherent because there's less lubrication because of the motion. So that gets passed off as an orthopedic pain, when really what it is it's a true Parkinson's pain. And I'm going to talk about the biomarkers of that in a minute. The other thing, type of pain that we talk about is the prevalence of the psychological pain cycle that influences the physiological pain cycle, okay? Here's an example. How do I get away from living with pain every day? Well, I can use a pharmaceutical, I can use an analgesic, which will take away the pain, they'll numb it, and then they'll combine it with an anti-inflammatory to reduce the inflammation process, which will reduce the analgesia that I'm having issues with, okay? But what happens that when you develop a physiological pain cycle, okay, that is not being managed by medication, exercise, nutrition, mindfulness, whatever, then it becomes not embedded, but manifested in your head, in your psyche, so to speak, that you become so involved psychologically in this pain cycle that it increases your anxiety, increases your stress, and increases depression, because you can't get rid of it. Therefore, it changes the chemicals in your brain from working the way they're supposed to, and now they actually contribute to the pain. So you have to break the pain cycle between the psychology and the physiology. And that's when I'm going to talk about biomarkers. The types of pain that Parkinson's with movement disorders are either neuromuscular, okay, orthopedic meaning bone, soft tissue meaning skin, okay, because your skin can become tight or tight, and that can be painful, okay. Joint adhesive type, where your range of motion in your joints are so impaired that the joints become stiff, okay, like I said, which is considered to be orthopedic, but really it's not. It's neurologically induced. Therefore, the chemicals you need, the chemistries that you need to help with the fluidity of the joints, the bursal fluid, okay, the tendon slip fluids. Another thing is we develop lymphatic pain as well. And lymphatic pain can occur in the armpits, in the neck, in the groin, and often people think that that's muscles, medical practitioners, and what that is lymphatic impaction, because we don't have the ability to get rid of the waste products out of the lymphatic system like the average Joe does. Okay, so you have the ability, because the lymphatic system is a trash collector, you have the ability to create lymphatic drainage with hardly doing anything. It's an effort for us. It's a conscious effort. And as folks with movement disorders lose the ability to move, they can't drain as well because they've lost the natural movement. Okay? Therefore, it creates pain in odd areas, groin, armpits, and neck, that are often misdiagnosed. So here's the solution. First of all, pain is an early onset sign of Parkinson's symptom. Usually folks that have Parkinson's disease or movement disorders have the pain cycle issues going on prior to having more of the outward signs. Another thing is that they start to develop neurogenic pain or neurological pain that refers down nerves. Very common in Parkinson's, very common in movement disorders, but they usually have that referred pain prior to being formally diagnosed with Parkinson's or any other movement disorder. Okay? Another thing is that the body chemistries get so out of whack, okay, that when you have multiple symptoms going on at a time, often you have what they call functional overlay. And what that is one thing's causing signs and symptoms of another, and another thing's causing signs and symptoms of another. And often you're looked at as a symptom magnifier, or a pharmaceutical seeker, or a disability seeker, or a person that has psychosocial issues, mental health issues, and the functional neurological disorder diagnosis is given, and that is treated psychiatrically, is treated neurologically, and that is where a lot of people get stuck. So they're having all this chronic pain between the shoulder blades and their shoulders and their neck. They have pain in their legs, their arms. They have a decreased range of motion. They have dystonia. They may have a little bit of tremor, and they're still getting misdiagnosed. Very simple. Have your physician test you through your blood work for lupus, Lyme's, autoimmune disorder testing, and also your sedimentation rate and your ANA rate, and I can't say that word tonight, antinucleic acid rate. And those will tell him whether you have real-time inflammation going on in your body. In addition to that, have your physician give you a visual analog scale that you can, it's got smiley faces, frowny faces, and everything, and have you circle that where you are a majority of the day, and have you trail that in between visits. So let's say you have your blood work done on Monday, he's going to see you back the next Thursday. Have him trail 10 days of your pain level using that visual analog scale. There's lots of other scales, the 1 through 10 scale, and then there is the King scale that they use overseas and in Canada, more in your socialized medicine countries. By the way, that a lot of times do a little bit better job with pain management with Parkinson's than we do. To get back to what I was saying, so the physician does this, and also check your cortisol levels. Your physician does all this blood testing and then sits down and says, yes, you have inflammation going on. It's definite. So let's do this. Let's go ahead and treat the visible signs that you're having. Maybe the bradykinesia, slow movement. Maybe the dystonia, the cramp that you're having. Maybe the decreased range of motion in your extremities, like what you have, like what I have right here. Okay, so that's physical therapy. The raspiness I have in my voice that many of my friends with movement disorders have is because one side of the vocal cords are hyperadducted, okay, and they just kind of drop down, so every time you talk, they rattle and makes it hard to swallow. Send them to speech. Also, if they're having trouble with their activities of daily living, like feeding themselves because their hands don't work right, get them the adaptive silverware through OT. So now that you're multimodal, pain management doesn't always encounter nothing but pharmaceuticals. Physical therapy, speech therapy, occupational therapy can be the therapies or the modalities can break that pain cycle physiologically and then help you develop pain strategies, how to deal with pain strategies psychologically. Therefore, bring the social worker in, bring a clinical psychologist in, bring a pain management specialist in that can help you deal with the pain without everything being pharmaceutical. That's a lot of talking without stopping, which I couldn't have done without Lori McKee and our 4 months together of 4 days a week of Lee Silverman voice therapy. And God bless Lori, right on the front lines at Atrium, speech therapy, and when they weren't able to see patients, right there in the hospital taking care of patients. Doing COVID screenings. So if you ever are in Shelby, North Carolina, and you need speech therapy, Lori McKee's your person, okay? What I'm trying to say is this, that as a movement disorder patient, as somebody that has Parkinson's, Parkinsonism, Parkinsonian-like behavior, movement disorders, you're going to have to be your own advocate. Read. Don't read that stuff on WebMD. Go find peer-reviewed articles, that means by other medical specialists. Then sit down with your physician and tell them exactly what you want. I want my blood work done to find out about my inflammation. This is what I need done. This is what I want done. And you're going to do it. And if you don't do it, I'll find somebody else. Another thing, if he or she says they think you have Parkinson's disease, don't waste time. Don't wait the 3 years. Don't let Blue Cross Blue Shield, don't let TRICARE turn you down. Fight it. Tell them you want a DAT scan. Okay? Hey Karen, my sister Karen's on tonight. She was with me when I had my DAT scan, along with Marianne. demand a DAT scan. It's a full day activity. It's a wonderful opportunity to get out of town. Had mine at Duke, and it was an all-day thing. And within a couple days, I knew I wasn't diagnosed with Parkinson's. Talk about a ton of weight taken off my shoulders, but it did confirm the other movement disorders. So, excuse me. This is something that I just have to deal with. I apologize for the yawning. Demand that DAT scan. Demand it. In addition to that, the speech, having them send you to an ear, nose, and throat specialist if you have a raspy voice. If you're coughing, that's a motor problem when you eat. If you have difficulty forming words, as my sister Karen would say, I make words up, okay? Have that doctor send you to an ear, nose, and throat person to be evaluated so you can get that taken care of. And then if you do have an issue, they can send you to voice therapy, and they can also send you to get a modified barium swallow, to see how you swallow, and you can get that taken care of while you're at voice therapy. So the nice thing about it is, if you have a treatment plan in your head when you get to your doctor, or even if you're midstream, it's been a year and a half and things aren't getting better, and you come in with this new treatment plan, and they say, well, where did you get it? You say, I got it from the research. This is just the way you should take care of somebody. You know, when you're diagnosed with cancer, they just don't test you for one. They do a PET scan and try to find all of them. Well, why not do that with Parkinson's? Just do the DAT scan, okay? I have a loved one that has Alzheimer's. They didn't play around, okay? Did not play around. Let's do a PET scan. Let's do an EEG. Let's do an MRI, with and without contrast. Boom, 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 boom. Solve the problem. Then they do the neuropsychological testing. Boom, 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 boom. They also need to do neuropsychological testing with folks that have Parkinson's to see if they're edging towards Lewy body dementia, or if they're having psychosocial issues, or are going to be more prone to having dementia with their dementia associated with their movement disorder later on down the line. Why not have that test done? That's an all-day affair, okay? And they can take apart all the domains of your brain and figure out where you have deficits and strengths. So, let's put this all in a single thought process, okay? If you have any signs or symptoms of a movement disorder, and one of your primary issues is pain, one of your primary issues is loss of range of motion, one of your primary issues is discoordination, one of your issues is cramping, go to your doctor and tell them what your issues are, and let them know what you think you have. And then make them prove to you what you have through the grand scale of testing, which is blood work, motor evaluation, cognitive evaluation, neurological evaluation, and psychosocial evaluation. Once they've done all of those, then they can put the scheme together to find out what you have and how to deal with it. And whatever is going on with a movement disorder, then go the multimodal approach with speech if you need it. You definitely need OT, occupational therapy. You definitely will need PT for your strength, joints, your balance, okay, and at the same time, your coordination, your kinesias, all right, kinetic movements, kinetic efforts. Then get your family involved and not only do the support group thing, but sit down with a clinical social worker or a clinical psychologist and talk about mind setting and goal setting and mindfulness to help deal with the trauma related to having a movement disorder, okay? That way, when you do all of that, you have this big, how would you say, bubble around you of care that will help you adapt to the pain cycle, adapt to the loss of motion, adapt to the changes in activities of daily living, help you with swallowing difficulties, help you with your speech difficulties, and it will just make you a lot better person, okay? And you must fight for yourself. Alex is on tonight. As always, good to see you, Alex. And Alex will tell you the same thing. You've got to advocate for yourself. You have to have a large network of support in order to get through this thing. Okay? So that is pain management. I personally believe, as a former caregiver, as an athletic trainer, a medical professional, that we need to avoid the use of opiate drugs and heavy-duty analgesic medications, and stay with the scalaxin type medications that deal with the musculoskeletal system, because that's where most of the problem comes from with movement disorder pain. Have an EGD and colonoscopy done to see if your esophagus is inflamed, to see if you are having GERD issues, to see if your gastrointestinal plaque is building up and the cells aren't able to break down things, and what's happening is it's radiating that inability of the cellular network between the brain and the stomach to work appropriately. So the manifestation of the infection in the gut causing the Parkinson's of the brain, have that done. And when you get all of those tests done and get all of those results, you can have a comprehensive plan. Don't forget your nutrition. See the nutritionist. Avoid the red meats. Get on the Mediterranean diet. Stay physically active 30 minutes a day at a minimum of 3 times a week. So don't forget the exercise. At first will increase your pain, but later on will decrease pain because range of motion improves, stamina improves, muscle tone improves, the internal nutrition system improves. You get more sleep and a better sleep because the tonins, the natural melatonin, serotonin that helps you with your circadian rhythm helps as well. Okay, enough about that. I want to make an announcement tonight. This comes from Rescue 22. And I'm one of the lucky folks that received a service dog because of Rescue 22, because of Eric Ennis, Ranger Ennis, because of Angela Connor, because of a lot of people, John Devine, a lot of people I don't even know in the community, because of my family, being involved with this process, and we also, together as an Embrace the Shake community, got Biggie for Maddie, and Maddie and Biggie are doing really well. As I told you at the very beginning, Maddie is a very private person, and she always has been, and she always will be. and her and Biggie are doing exceptionally well together. Soon as this COVID crisis passes, we will do a joint interview with our dogs on Embrace the Shake and some other platforms that we use. And you will see the magnificent changes in Maddie and the magnificent changes in Biggie. I mean, Biggie is a handsome dog, the perfect dog for Maddie because of Maddie's stabilization. Excuse me. And mobility assistance that she needs. Biggie is just perfect. But what I want to talk is that it's time for Embrace the Shake and the Embrace the Shake community to support Rescue 22 again. My friend Craig Kohlberg is a combat veteran of Iraq. Craig was severely injured in an explosion, an IED explosion, and had a massive brain injury. Also had some physical injuries. Was evac to Landstuhl, Germany. Was taken care of there, and his only focus when he was in Germany was to get back to his unit, to get back to the guys that he served with, and he wanted to, as he said, I wanted to finish the job because I'm part of a team, and it's, I have to get back to my people. Well, Craig was separated from the service medically, and he is 100% disabled. And as a result of this trauma caused by an IED blast, he developed Parkinson's, trauma-associated Parkinson's, from being exposed to repeated explosions, not only from this IED itself, but at the same time, the concussion and the blast elements that we received from rifle fire, because the closeness of the weapon to the head, the ejection port being so close to an ear, and the elements in combat where you have rifle fire, automatic and semi-automatic weapons going off everywhere, and your ears aren't protected. And if you are wearing ear pro, what we call Christmas trees, those garbage pieces of rubberized plastic, didn't work. Not only does it cause hearing issues, but it didn't help much as far as protecting the brain from the blast. Craig has severe dystonia. He has a shuffling gait. His knees and his lower extremities have some atrophy. He is being seen by the VA. He has been approved by the VA for a service dog for mobility, and Rescue 22 has taken that challenge. And Lawrence, who works for Rescue 22, who works for Embrace the Shake, does a lot of pro bono work, but she also is working with Angela at Rescue 22. And right now, if I understand it from talking with Marion today, she's putting up our fundraiser. And I know times are tough. I know that the virus has a lot of folks not working. But this is an American hero that almost lost his life defending somebody he didn't know, defending what is right about our country, because we are the light, to bring peace to a country that was in complete turmoil by a dictator. And he was a young man, and he volunteered, he signed a dotted line, and he got hurt. And it is our responsibility as American citizens to forget about all this strife that's going on in the world and help to take care of one of our Americans' greatest, the second greatest generation, okay, the X-Men. Craig is 42. He lives in McAllen, Texas, and he does the best he can to live every day to his fullest. He has a dog right now named Bella that he is, it's a Malinois, and she's a just absolutely beautiful dog. And Bella is being just obedience trained by Craig as a favor to a buddy of his that just wants a dog to around the house. And Craig offered to foster this dog and has done an outstanding job with basic obedience. Well, Craig's disease, his Parkinson's, is advancing, and he needs a dog for mobility. And Rescue 22 is his best bet. Rescue 22 is going to, has spotted a dog, named a dog for Craig to receive, is being trained. The dog's name is Kai. Kai is a Malinois. And soldiers need high drive dogs because it represents the high drive that a soldier has in his training and on the battlefield. At the same time, this dog will represent the team concept that you have with your battle buddy. You go everywhere with your battle buddy. You never go by yourself. You're always with your battle buddy. You're always with him. And your teamwork, the daily training that you will have to do, the ongoing training every single day with this dog that Craig will have to do after Eric trains him. And then Eric goes to Craig's house and spends time with him and gets the commands right and does the training necessary for the handler. And then it's an ongoing everyday thing, making sure that your service dog's equipment is right, the lead is right, the lead is well taken care of, it's not frayed, it's not rusted. All the equipment that the dog requires is maintained. This represents the soldier's lifestyle. Another thing that this dog will do for Craig, and dogs do for veterans and first responders and those who need service dogs, is the unconditional love and the unconditional commitment to the individual that has this dog, that has a service dog. That's what we're going to do for Craig Goldberg. I don't know how much money we need to raise. That's not even been discussed how much we need. But here's what we need to do. We need to raise this money for Kai and Craig to get together. And then we need to raise enough money that the ongoing training of new skills happens and takes place at no expense to the veteran. Look on the Embrace the Shake Facebook page. The information will be up. Marion's putting it up. Look at Rescue 22 Foundation's Facebook page. I'm sure they'll be. All right, we're good. I'm going to press on. And finally, I'm going to wrap up and say, I'll put the information on here. We're going to use GoFundMe because we had such a positive outcome last time. So once again, thanks for being on tonight. Let's help Craig get Kai. Remember Rescue 22. By the way, you can go on Amazon when you make your purchases. Look for the Rescue 22 link that's on there. And I think it's called Smile or something like that. And a portion of the proceeds from Amazon will go to Rescue 22. So, Craig Goldberg, United States Army, 10th Mountain Division, combat injured. Let's get Kai to Craig. Let's raise this money. Let's support our veterans like we're supposed to. And let's take this energy that we're wasting on Facebook with all this counter discourse comments. Take that energy and direct it to something positive and direct it to a purpose that's going to benefit somebody else. So, thanks again for watching. Thanks again for listening to me ramble. Thank you to all my sponsors and all those that support the service dog movement. God bless America. God bless the 75th Ranger Regiment. Pray for our EMS, fire, law enforcement, and our soldiers on the battlefield, and all our healthcare workers on the front line. And always remember, let's embrace the shake. Have a good evening.